Then I started talking to myself, and I said, self, and I said, self, you gotta have a good heart. I said, if you want good things to happen in your life, and if you want good things to happen for others, you gotta have a good heart. Yeah, I said to myself, if I'ma have a good heart, I'ma make a good start by saying good things.
All the children or anyone willing to learn from each other for building more schools and less prisons. To the youth and everyone willing to hear the word of truth.
My name is Montel Jones, and I'm working with Candace and Matthew Hill. And our project is, we're working on 2 projects. We put 2 together. Focus area number 2, increasing family income, assets, and employment. And focus area 5, supporting healthy environments and lifestyles. I'm just going to talk about the the health lifestyles and the areas that we're
Finally, there's no hold up to the progress we make when we grow up. Let's stay childlike.
My name is Matthew Hill.
My name is Kayla Hill.
Okay, Kayla. What do you eat on a daily basis? What does your diet consist of?
Salads, fruits,
Salads, fruits,
etc.
What now? Like, what do you eat for lunch and stuff?
Subway.
Subway,
Yeah. Healthy stuff.
healthy stuff. Why do you have to eat healthy stuff?
Because I have type 1 diabetes.
Type 1 diabetes. How did you get type 1 diabetes?
By eating non-healthy stuff every day. And too much sugar.
Too much sugar in your diet,
Yes.
and they cause you to have type 1 diabetes.
Yes.
So, like, before you had that, you were just eating whatever you wanted to eat, huh?
Yeah, like free.
There was just no restrictions on your diet, huh?
No.
So, like before you was diagnosed with it, how did you feel? Like
I felt fine and energized.
it was just kept you on the go, whatever you wanted, huh?
Yes.
So, how did you find out that you had it?
Because I was real sick. Like throwing up, a stomach ache, a headache. I could walk, but I really couldn't. I just kept getting sicker and sicker.
So, what did they tell you when you went to the hospital?
That I had type 1 diabetes. Yeah, and my blood sugar was 900, and if it's 1,000, going to a coma.
So if you wouldn't have went to the hospital, you could have been diagnosed in a coma?
Yeah, or I could have been dead right now.
So, alright, now we passed that stage. So, so now your diet is healthy. Well, you have to eat healthy, or what?
Or I get sick again and go to the hospital.
So, what would be your message to other people that just eat a lot of junk food and stuff?
My advice is, if you don't like shots and being sick, you should eat healthy and just take care of yourself.
Well, you can eat a lot of junk foods, but not too much of it though, huh?
Yeah, every time I eat, I gotta take a shot. So if you don't like that, you should eat healthy.
Because that can be one. That could be a condition if you have a poor diet, huh?
Yes.
So that would be your message, huh?
Yes.
So, I have another question for you. So, did you eat a lot of fast foods before?
Yeah, McDonald's, Burger King, all that every night.
Every night?
Yeah.
So would you say they contribute to you having diabetes?
Somewhat.
Because it's basically on you because you know what you was eating, right?
Yeah, but
you don't have
fast foods, they do sell salads and stuff, so it's really your choice.
Yeah. But you didn't have no guidance. You would have ate healthy if you knew that this was a risk, but you didn't know it was a risk, right?
But some people are born with it, not me though. I'm just saying.
Some people are born with it, but you just said, so you'll kind of say, like, you ate your way to diabetes, or?
Somewhat. It's like 50-50.
So,
Because I could have been living with it since I was born, since I was
Announce your sincerity.
16 years.
Heard that.
you would just say, like, try to eat more healthy. That would be your message.
Yeah, everybody in the whole world should eat
For
healthy.
youth, it's harder because you're still under the influence of your parents, and that can be tricky because if your parental influence is not influencing you to do healthy things, I can see how that could be a hard decision for you. So I think maybe possibly developing a support group within your friends, and you guys kind of have your own little health group, however that looks per se. Also, there's a group called we'refedup.org. I'm not sure if you guys have heard of them, but they work, around these issues, and they're all teens and they're youth, and they go to different high schools giving free presentations about nutrition and obesities and diabetes prevention. You guys can start your own we'refedup.org type group. You could also, if you're still in school, if it were me and I was still in school and I was a teen, I would go straight to my principal or whoever was in charge of these food programs at these schools, and I would get like a petition, petition people to sign, and I would literally just advocate for healthier food choices at your school. I mean, you have to engage in some kind of advocacy in order to make this stuff work. That's from my experience. That's what I have come to know. That really works. And then also talking to your parents. If you really want to.
When people walk by, go in the house, go to work, all that kind of stuff. Well, you guys are all urban planners because you're all part of the city, right? You're all part of you're all part of the landscape out there. When you walk out this door, you're part of the whole street, right?
Yeah.
So the whole idea is that we want to get your ideas about urban planning because you have all the experiences. And just think about your everyday behavior patterns. What do you do every morning? What do you do every night? What do you do in the afternoon? And think about how that would be part of that whole square. So with that, you'll have 20 minutes to use all these objects there. You actually design, huh?
And put them on here.
Yeah. And you have to design multiple squares for yourself.
This is my 5-star hotel and the energy resources that runs that gets it started. And this is my bike repair shop, and it also has a vending machine with healthy drinks in it just in case the workers, they get dehydrated. This is my Martha Square.
Even never when we all are being tested.
Do you believe that it is much more difficult for the African American ethnicity to obtain a high-paying job?
Not necessarily, no. If you're competent, you may not get hired by the first company you go to. You may get hired, but you can get hired by a lot of different companies that employ people. I think part of the problem is that we don't have enough businesses in our community.
Hi, my name is Candace Red, and I am currently an intern with Community Build, where our main goal is to rebuild the Marlton Square area and help build the community as well. I'm in a group with Matthew and Montel, and today we basically walked around the Leimert Park area and did a lot of interviews. We're working on 2 projects actually. The first one is with focus area number 2, increasing family income, assets, and employment. And the second one is supporting healthy environments and lifestyles. Since I've been working with Community Build, it's been a really, really, really good experience. I'm tremendously excited about it. I was referred by a friend, Aja Dawson, and she informed me that it's actually a form of community service, which I was definitely interested in doing because I want to help the community and help build the community as well. And I felt that this would be a great opportunity to do so because I'm also gaining a lot of experience and knowledge about my community as well. So today I basically just walked around and interviewed about 5 people in regards to focus area number 2.
Where are we going now?
Family income, assets, and employment. And I asked about 5 residents in the community in regards to how they felt about the community overall. In regards to just the community. It's not here. Okay, I definitely will. Thank you so much.
Okay, you are?
Candace Red. And what's your name?
I'm James Fugate.
Okay. And the first question is in regards to Marlton Square. Do you happen to know what Marlton Square is? Okay. So it's currently an empty space filled with just the community's trash. In order to help rebuild and beautify the community, what would you like to see in that area? If you had the power, what would you put in Marlton Square?
Well, it needs to be redeveloped with a competent redeveloper. There's a lot of history that you can find on the LA Times and other places about Marlton Square, but it'd be nice to see some nice community shops there.
Okay.
African American oriented businesses.
Okay.
Not Barnes and Nobles and Borders and other things that come in that will put bookstores like ours out of business, but also, food and eateries and things that help develop our community.
It's all love, no question. Righteousness in itself is rewarding. Deeper and deeper we read and research, looking for answers to unknown things. And finally there's no hold up to the progress we make when we grow up. Let's stay childlike.
My name is Johnny Raines. I've been in this community essentially most of my life, since about 1956. My parents moved to 2nd Avenue in Vernon. And going through it, working with these young people, I'm just so impressed with some of the thoughts and ideas and the level of detail that they've been able to come up with without any, if you will, formalized training or anything, but just really from their heart and from what they've seen, what they want, what they haven't seen, what they haven't experienced, and what they would like to experience. That's kind of the foundation, if you will, of what I'm walking away with. That putting our future, if you will, in the hands of young folks is not a bad idea at all. One thing in particular, one of the discussions we had around the Marlton Square area, where one of their first thoughts was green space, education facility, and transitional type housing. Well, I've sat in meetings over the last 5, 6, 7 years with large groups of supposedly very knowledgeable adults, and none of us have come up with anything so succinct and so necessary as just those things that these young people were able to come up with in 4 hours or 6 hours. So if I had to pick one thing that I've really learned out of this, is that given the opportunity, our young people, our youth, are more than capable of being entrusted with our future and the futures of our communities.
Cool.
And I have developed a kind of respect for community build that I didn't really have at first. I respected the work that they do, but I didn't know the work that they really do and how in depth they are with the work that they're doing and how they actually care about the kids. They're not just getting money to put into a program so they can pay high salaries to some people and give a few kids a job. That's not what they're doing. They genuinely care about these kids. And that's the part. That's the part that has moved me so much this summer. That there's somebody who cares, and the children are going, the young people are going to benefit from it. And I would do it again. I'm tired, but it's a good kind of tired.
Yes, my brother, yes, my sister.
We thank you, Mary.
Man, human, stuck here together. Cool, real cool. That feel good. So easy now, there's always options. Go, man, go. Don't stop, get yours. Stay on top, seek more. It's all right.